Here we go.
What a week we've had.
Yeah. Oh my God. Runapalooza, Tulsa, Oklahoma.
I'm sorry, Sandra, this may get political. I'm just saying.
Hopefully we see her face. We can have her join. Oh, Gerda's here. Oh, that's good. Heather. Hi, Sandra.
Gerda had a request to see your dogs, but I don't know if she knows that you have 4 dogs.
Yes, we have 4, and I just let them out. So.
And they're all bigger than Sanjay, so.
Well, they are. Some of them are bigger than me. So,
I'm unmuting.
Okay.
Do you see, well, it's backwards, but do you see Leslie's background?
Yes, Monudo Sheet Industries. Yes, our logo. I love it. Yeah. So hi Madeline. Hi Lorene. So
Yeah,
Michael's here too. You enjoying the summer? Hey Mike, you enjoying the summer yet? I know you're more of a snow guy, but
I think I'm done with the skiing. Maybe one more day.
I can't believe it. Mike's the only guy in the world that goes skiing in at the end of June.
I did 4th of July last year.
So Gerda, did you really 4th of July? My God. Gerda, did you was that answer on herd immunity what you were looking for to hear, or did you have anything that I might have missed?
Backwards for you.
You were the first person who has been able to give me a perfectly coherent and comprehensive answer on that question. Thank you very much.
Thank you for submitting it. Yes, we've been following it for a couple of weeks, but thank you for the compliment. And yeah, I mean, different infections could be tackled with a herd immunity strategy, but this one specifically, its characteristics are such that we're not able to really utilize it as an effective strategy. That's the best answer I can give. But there's a lot of other details.
You know, where I live in Arizona, in Phoenix, Arizona, our hospitals are now pretty much full, and my physician friends who work in ICUs or in ERs are, because they now, as you mentioned, they now know, they've learned more about treating the disease. They say folks stay in an ICU for 4 to 6 weeks.
Yeah.
So the ICUs are full.
Yeah.
It's not like normal times when, there would be a quicker turnover. So the concern really seems to be for them long-term, what kind of capacity there is in ICUs. And our governor or politicians just talk about beds.
Yeah.
As if an ICU is a bed and a ventilator. An ICU is people, highly skilled people.
Correct. Yes, it's a very, very highly specialized environment. And when the biggest issue that we have is the length of stay in the ICU. If we were able to transition patients quickly around as a result of having the specialized care for a shorter period of time, say 6 to 8 days, like we do in trauma cases or in other cases, or as a step down resort to very, very critical illness, then the scenario changes. But I've gotten case reports of patients that have been. I even got a case report of a ventilator patient that was on ventilator for 10 weeks. That's unheard of. 10 weeks is unheard of. I mean, even patients that unfortunately suffer brain death are never kept on ventilators that long, or very, very rarely kept on ventilators for 10 weeks. There was a patient in Oregon who was in the ICU for 62 days and lost 9 of 10 digits from the clotting and went home. And then another one that has 72-day length of stay with 58 days in the ICU. These aren't the norm for the severe cases, but even then, the average length of stay for a COVID patient in the ICU is now 12 days. That's double what the normal critical care patient is. I noticed that you have South African roots, and
Yes.
do you have you had any recent conversations with friends, family back in South Africa about how things are faring there?
Yes. They have had a severe lockdown. Level 5 was where they started. It worked very well in certain areas, did not work so well in areas where poor people live, because hard to lock down when
Yeah.
you share an apartment or a shack with 10 other people, and hard to find food. So a very severe lockdown, but pretty good compliance with it. And but unfortunately, it caused a lot of harm to some people. And because we have very high rates of HIV and tuberculosis, an additional problem was that people did not continue their HIV and tuberculosis treatment while they were in lockdown. So there's a new problem now of not being able to take care of all the different public health issues at the same time.
Yeah. I also heard about the same problem with standardization. So, Durban versus Joburg versus Cape Town having different approaches, and obviously the socioeconomic disparity. So
the one interesting thing is, I can send you this, I'll email you the graph, but the excess, they have actually, since the start of the lockdown, we haven't had excess deaths in South Africa. It's actually lower because we haven't had that many deaths from COVID-19. Plus, we've cut out a bunch of deaths from trauma, from car accidents, fights, stab wounds, kids breaking, falling, falling and hurting themselves. So it's fascinating that, it's just, okay, some cases you're now going to get people whose TB or HIV is getting worse. In other ways, a lot of people have avoided drowning or dying in a car accident. So
yeah, we're seeing statistically, we're seeing very similar things here in the U.S. I mean, some of the counties with the best reporting are not around our urban centers, but slightly suburban, and they are showing that there were a lot of questions about why aren't we seeing as many heart attacks? Why aren't we seeing as many strokes? Why aren't we? Well, the activities associated with the onset of such critical events are so reduced that these people aren't coming into a scenario where a heart attack would be more likely or a stroke would be more likely.
right.
So that's an odd inflection in the data. But the number of car accidents and other things that have dramatically dropped, fatal car accidents. So
Wow.
it's weird. One of the things that we saw in Florida, and I think we're going to see in South Africa, I've been following South Africa as another, South Africa still has the best public health infrastructure in Africa.
Yes.
Yeah, and so to try and follow South Africa as bellwether for the rest of Africa is not exactly accurate, but at least it's getting some data to see, how or why COVID hasn't affected African continent like it has the other continents. We have a molecular theory. We haven't fleshed it out yet, but it has something to do with the receptor that is associated with the ACE2 receptor. In African populations, it's slightly different than in the other races. And it may be that that is conferring some level of reduced infectivity. We don't know yet. But, or Occam's razor, the health infrastructure and reporting infrastructure on the entire continent is so horrible that we don't actually know what the counts really are.
Yes.
We don't.
Although I get, I have several family members and friends who work in the public health infrastructure, so hard to tell. I would just say, hearing from them, it's a mix. In some places, things function very well, and in other places not. It's very uneven, depending on the socioeconomic status and at the local level, leadership. I mean, leadership is just so important, as we have discovered. So, one thing about nursing homes is, anecdote from South Africa is that my sister-in-law is a nurse practitioner and runs a clinic at a nursing home. And they haven't had any infection among nursing home population. But what they do is the nursing home staff are dedicated only to that one nursing home. And the staff are well paid. So, and the staff are well trained in PPE use, and they come in a sort of, they change in and out of PPE the way surgeons would do at a hospital.
Wow.
So and then the staff are tested regularly, and the folks who live inside the nursing home. But the one thing that really seemed to work for nursing homes was to make sure that staff don't track virus into the nursing homes by paying them well so they can only work there. They don't have to work in 4 different nursing homes, but also by making sure they put on PPE when they come in and take it all off when they leave.
Yeah, absolutely. We failed at that here in the U.S. and New York State especially has the highest number of nursing home deaths due to COVID because there was just no protocol for keeping the elderly safe. And, how they treated their individual nursing home populations depended on that particular nursing home's protocols. There was no state standard or national standard to have all the workers tested and all the workers using PPE. And, I think that's one of the biggest tragedies is how many elderly we lost in all of this. Just horrifying.
It's heartbreaking and shameful.
Yeah. Cynthia, Madeline, Carol, nice to see you guys. Sandra, you were holding a piece of paper, Sandra. Is there a question on there? No, it's for something else. Okay.
No, it's unrelated.
Okay.
I thought you had some with a marker on there that she was going to say, no politics, Terry.
Yes. I expected politics.
Okay, no, but this is the post show, so politics are allowed. So Sandra, I've got a question. For Sandra. Here we go. So would you go to a Trump rally in Wilkes-Barre, Scranton?
No.
Okay.
No.
We're having one in Phoenix today. He is here. And
Arizona. Yeah, he's in Arizona. Yeah. Where in Arizona are you, Gerda?
I'm in Tempe, which is part of it's right next to Phoenix. It's part of the Phoenix metropolitan area.
Yeah.
It's really big universities. Trump is further. He's on the outskirts at a church. And people are packed in there without masks. So.
Oh, really? I mistook it. I thought it was a rally, but I didn't know it was indoors.
Oh, he is. Yeah, he's at a rally in technically Phoenix metropolitan area, and people have been lining up since, I don't know, dawn.
I
Wow.
believe it was a student rally that was started off
It's,
with.
Oh,
it's,
okay.
it's complicated. A student organization sponsored it with a church. It's really the church, but for complicated reasons, the church had to be sort of below radar.
Oh, okay.
I wonder how many TikTok people showed up.
That's a mess. That whole thing was a mess. What a mess.
I'd say 1 million.
A million, yeah.
Yeah.
Hey, you were talking about nursing homes, and it was about, I think, right after our last meeting that I read about a nursing home in Baltimore
Hmm.
that had no deaths. And the director explained that he was watching TV back in March, and the president said everything was going to be okay. So he panicked, cut off all visitation, started regularly testing his employees, and he didn't lose one person. So
There you go.
Wow.
You just do everything
that's
the
true.
opposite of what they tell you.
True
Yeah.
story. He said he panicked as soon as he heard that, and he did not lose one person.
Well, thank whoever, but honestly, if that just use the example, right? The example is diligence and vigilance, and like just being overly cautious with people in nursing, with the elderly, especially when we learned. I mean, oh my God, the percentage of deaths in Italy of over 65 was 47%.
Yeah.
I
Well,
mean,
protecting people in nursing homes, you would think is common sense.
yeah.
You would think to keep them separate from COVID patients. I don't understand how.
Well,
That's the
Sandra,
problem.
Go ahead, Carol, or Cynthia. Who was speaking? I couldn't tell.
It was me.
Okay.
I was just saying that's the problem. And what I hear from a lot of people is it's like, the people know what to do. The people will make their own right decisions, but they have to put a warning label on an electronic drill that says not for dental purposes. People do not use common sense.
True.
And I was listening.
Dental.
Hey, dental work is expensive. Come on, dental work is expensive. Give us a break.
That is true. That is
Last
very
night I was listening to our local common council meeting, and our city and the woman who leads our health department are currently being sued by a business owner because they were trying to keep the city safe, and it wasn't like super strict rules, it was like limiting how many people can be in a business at one time and stuff like that.
Yeah.
And the amount of leaders in our community, I should state our fatality rate is 3%, and out of 100,000 right now the rate is, I think it was 1,078 positive.
Yeah. That's
So
a lot.
yeah, so we're at a really bad spot, and the leaders in our community are saying it's against the Constitution and we need to let the people as it's like, what part of the Constitution are you talking about?
Yeah,
It says nothing about TJ Maxx.
I find it odd. I find something very odd. I live in, as you guys know, I live in northeastern Pennsylvania. Sandra lives right here close by. And our area historically we've been somewhat of a blue state, but not reliably blue. But like similar to Ohio, but more blue than Ohio. And the eastern part of the state in the southeast is blue, is liberal because of Philadelphia. And then the western end of the state, where Pittsburgh is also kind of liberal. But the rest of the state is largely conservative. It's largely red, in the counties where it's less populated than the cities. Northeastern Pennsylvania, I would say, has grown more conservative in the last 15 years. And I haven't seen anyone being obnoxious about mask usage or being discourteous or anything. Now, I was in Wilkes-Barre, and I was at the Turkey Hill, and there were people going in like this because they didn't have a mask. But for some reason, it has gotten through to Pennsylvanians, and we've been largely, by the numbers, successful. And week after week, I praise my people that I see every day in the back mountain, that are up at 6 and going to work and going in to get their coffee with the mask on. And I don't see why it's objectionable. I just don't see it, and neither do they. They as far as opening up small businesses were hurt the worst. People with mom and pop shops and restaurants and they derive their monthly income on a week to week basis to pay their bills and employees. They got destroyed. Let's admit it. Okay. And plenty of blame to go around. Where I like to place it, but the faster you put in place containment, the faster those businesses can begin to,
Absolutely.
recover. Now, if you're going to continue to just pretend that it's over, and you continue these ICUs will get overwhelmed. Gerda just told us about it in Arizona. They will get overwhelmed. These hospitals will start sounding the alarm. Then the counties will start shutting down again, and then they'll get hurt all over again. Okay.
And what will an economy look like when so many people more people are on unemployment, getting disability for the rest of their lives because, like you said, of the morbidities, and they have a sick workforce. You need employees to run a business.
Yeah. And I think one of the problems that we saw here in Pennsylvania was a lot of these owners said, I don't know anyone who's been sick. No one in my family has been sick. None of my friends have been sick. I don't think these numbers are even real. Okay. And I'm hurting the most. Meanwhile, Lowe's is still open, and Best Buy is still, well, I don't know if it was, but the big companies that could survive the storm, they were still allowed to be open because they were considered essential. Whereas, the place where everyone got breakfast down the street that was owned for the last 38 years by, a local couple, they were forced to shut down, and they're hurting. So there's plenty of those voices that have a reasonable argument, right? They have a reasonable argument. But now they have to understand that containment is going to allow them to begin recovery. The faster containment is achieved, the faster they can begin their recovery. The longer it takes, and then potentially the complete loss of control that we're beginning to see. You saw that freaking graph, okay? We were like this for a while, and now what is this for the last, 14 days? And led by these big states, Florida and Arizona, or at least Texas. I mean, then what? We're going to really act like we're not the United States of America? New York and Pennsylvania are going to say, no, I'm sorry, if you're from Florida or Texas, you can't come in. Are we going to start doing that?
Yeah.
We may have to.
Yeah. Heather, ask your follow-up Charlie question. We've all been following the Charlie drama. You might as well.
Oh, he came in as of last night, but I haven't let him back in the bed yet.
Oh, Heather.
Charlie, we know too much about you, Charlie.
Wait, in Heather's defense, she does have a heart issue that she's worried about.
Okay. Yeah.
I pretty much know that if I get this, I'm going down. That's in my head.
And she's type A blood, and she has a heart issue, so.
Just being extra cautious. Gotcha.
And I'm OCD. But I mean, obviously, and also the problem is we can't get any consistent information. Like the health department told us one thing, one doctor told us another thing, another doctor. It's like, we had to totally just like make up our own plan.
Yeah, not cool. Not cool at all. We had the same thing here in Pennsylvania. I'll tell you honestly. Health system to health system, they're not giving solid advice, and they're not doing it consistently. So last week I told you the story of the mom of the 11-month-old boy tested positive as a result of being in daycare. Then they tested her, but then didn't ask about anything else. Didn't ask, where's the dad? Where does the dad work? Do you have any grandparents that the kid is around? Any siblings? Nothing. Like, she asked her close friend, who then put her in touch with me,
Jeez.
you know? And you know, then I was the one that insisted on the follow-up and the testing and the other stuff. And luckily everything's working out. But how many moms are out there, or how many husbands are out there that are working like your husband and are coming across exposure and don't have the information? They are the reason this is continuing to spread, because they
Yep.
feel fine. They
Yep.
feel fine, and they feel fine. They're not getting tested. They go back to work. They spread it to 3 other people, and this process goes on, because we're now in month 5. John and I have been doing this for 14 weeks. At some point, I'd like to stop. I'd like to have my Tuesday evening back, but I'm not going to lie. I love seeing your faces. I love giving the information to people and seeing them saying that it's useful.
Hey,
And I feel-
Terry and I thought we were taking this on the road.
Yes, we are. Well, Terry's going to do all the arrangements. He's got our logo done. We're going to put it
Leslie
on
did the
truck.
logo.
Huh?
Leslie did the logo.
It's beautiful. I love it.
Oh, she flipped it. It's going the right way now.
That may be a long-running gag.
So I
How's
kind of
Utah, Mike? How's Utah doing? And then we're gonna go to Madeline, because I can't.
Utah's getting scary. Like, Utah was doing well up
Uh-huh.
until this past week.
Yeah, I saw the numbers. Why? What's the deal?
I mean, if you saw what the highway looks like right now, where everybody's whizzing all over the place, and you're getting people from out of state who are coming to our different campgrounds and stuff.
Okay.
And, you know, like, it's really flaring up to the point that the state epidemiologist is actually recommending, if it continues to go for another few days, she's talking about trying to shut the state down. Well, the whole state went absolutely nuts when that news came out, and the governor completely said, absolutely not. We're gonna keep on going, whether or not we're healthy or not.
No, everyone's saying that. They're saying that it was so painful to shut down for 2 or 3 months, or whatever, how many months, that it's not even a consideration to do it again.
I'm just wondering if we shut down way too early. Like, here, like, we thought we were on a totally different schedule than you guys.
True. Yeah.
You know, like,
I think Italy scared everyone.
Yes, Italy was the catalyst.
And then there was a statistician in England whose work was the motivator for how England and the U.S. reacted.
Yeah.
And that's why, you know, the whole scare about not enough ventilators.
Yeah.
We said we were going to have auto companies making ventilators, and now it turns out that isn't the need right now.
Yeah. I think our need is still PPE, and our need is testing. Okay. If we ramp up those 2 things to sufficient quantity, and again, you know, can we please, because this is stupid and this is a joke. This where the hell is it? This report to Congress on the COVID testing strategy, May 24th, from CDC. I don't know who's working at the CDC. I don't know who's working at the CDC or who's issuing these reports, but they're horrible. The one for the schools has been, the reopening has been horrible. The testing strategy is horrible. The reporting numbers are horrible. We're all of us who've followed CDC for 2 decades are really dumbfounded. We're like, this doesn't sound like the CDC to us. It really does.
Was there a brain
It's
drain?
complete amateur hour. Complete amateur hour. Like even the language they use is so absurd.
Did you watch the testimonies today?
I watched Fauci's a little bit, yeah.
Because, like, I mean, the thing that I learned is the people running our government cannot manage to hit the mute button on their Zoom call. So how do you expect them to run anything else?
Yeah, I saw that.
Like every single person who spoke today, they said, "Can you please turn off the mute button?"
Yes,
It was the most embarrassing thing I ever seen. And those are leaders.
Yeah, I know. We're in good hands, Mike.
I think that a lot of people that could retire retired when Trump came in the office.
I know that is true at NIH. I know that is true because after he submitted the first budget, they said, okay, it's going to be sequestration all over again. They underwent sequestration. Dr. Racimus, who came and spoke to us a couple of weeks ago, he left NIH because of sequestration. So when they heard that their budget was getting cut by $8 billion, some of the best of them just said, you know what, I'll go work for some university for a couple of years. I'll come back to the NIH when they've got funding again. So yeah, that could be the case because CDC does have a lot of grants that people publish under. Mm-hmm. And so if they can't get the grants for research, they'll bail. Same thing happened to NASA. You know, it's just.
Right. I visualize a bunch of Taco Bell employees moved up and got a job at the CDC. You know, they can make you a taco, but they can't tell you how long it takes to do a test.
No, Terry, I swear I saw a report that there was a guy that was like a Labradoodle breeder before.
Yes.
Yeah, right.
Remember that a couple weeks ago? He was made like head of a team at the CDC.
At BARDA.
Oh,
Yeah.
Yeah.
At BARDA, yeah.
Right.
Do not insult Taco Bell.
I can't eat Taco Bell, so nah.
All right, my friends, we've hit 10 p.m. I think we're gonna let everybody go.
Good night.
My
Thanks,
love
Sanjay.
to all of you. Stay safe. We'll see you next week.
Good night.
Wear masks.
Take
Wear
care.
masks.
Wear masks. Yes. Good night.